Okay, Ashok, so you came in for some structural integration work. How are you feeling?
Oh, well, after 4 treatments, I can see a few benefits already.
Ah,
Yeah.
okay. So tell me, what first alerted you that you had something that really needed to take care of?
Well, that's an easy one because a year and a half ago, I tore my right Achilles tendon, and that was a pretty quick wake-up call that something larger was going on.
Yeah.
Yeah, I mean, yeah, you know, like it healed up well, but you know, really all I got from the medical professionals was an agreement that there's a lot more people my age, you know, who are active enough to have that kind of an issue. You know? But
So
you know,
right away they were indicating it was age that caused the Achilles tendon.
well, there seemed to be a really significant climb in the number of injuries that people are having in their late 30s and 40s.
Yep.
You know, and so that made me think that even though I had been actively, you know, using a massage and things like calf releases, my calf was basically strong enough to tear my tendon, and there was an imbalance that needed addressing.
And then there were some other things. Like, you came to me for a shoulder.
Right. Yeah. Yeah. I was excited about getting back into rock climbing, and trained for it, and but managed to get into a challenging position and forcing myself out of it. Tore both rotator cuffs at the same time. Nothing as dramatic as what happened with the Achilles tendon, but just surprisingly difficult to heal. Every morning I would wake up and the symptoms would be a little bit worse. And 3 months later, you know, the tendon was starting to recover, and I really didn't have mobility.
Yeah. All right. So were there other things that other aches and pains or symptoms in your body that you wanted to take care of?
Well, I mean, not initially, but I mean, I've been aware of postural misalignment, both side to side, as well, you know, because my legs are different lengths, and because I let my head move forward, right? And you know, those have been long-term challenges, but they weren't what initially, you know, drew me to the treatment.
Yeah. Yeah. So how are you feeling now with all of those things?
Oh, well, I mean, it's just wonderful to be able to do this again.
Yeah.
I mean, it was literally a matter of 4 days. I saw the improvement every day, but by the time the 4th treatment was over, not only was I back in the pool doing a front crawl, but I could even breathe. I could breathe on my right side while doing a stroke on the left, even though it was an extension, and you know, my body, it was counter body. That was a lot to hope for.
Yeah, great.
After 3 months, you know.
Yes, yeah. So how many treatments before you could do the crawl?
After the 3rd one, I could do the crawl.
Okay, great.
After the 4th one, I could breathe on the side.
Yeah. And was it progressive? You noticed benefits along the way?
Yeah, no, it was progressive. I mean, you know, at first I was, you know, I was keenly observing to see, and I noticed the difference in sensitivity even as you did the same release on the right and the left side. You know? And that's actually when I started to think about the fact that, well, different leg lengths, you know, I've had, and you know, I'm being right foot dominant, right, right dominant, you know. You know, when I play volleyball, I jump right, that kind of thing.
Yeah. Well, you're very active. You do a lot of things, a lot of sports, and you also do swing dancing.
Yes. Well, this was a really nice thing also, was that, and I didn't expect this, but all of a sudden my rotations on the swing dance floor, were a lot cleaner. I didn't feel as much side to side going on,
Yeah.
off axis movement, and so that kind of alignment I wasn't expecting.
Right. Okay. Great. Anything else that you want to tell people about this kind of treatment?
Well, I'm walking taller now,
Mm-hmm.
and I think I had actually tried a fascia release many years ago, and all that really happened was that I think some of the fascia that had built up to counterbalance my head being forward, I was relying on that support, and then it was gone. And what was nice about the integrative technique that you took was that I had the advice about how to position my head, about how the upper body should feel, about allowing the shoulders to come down, and how the basin should be positioned in the hip basin. And so all of a sudden I'm walking taller now, and I get immediate feedback if I don't actually maintain good posture, because my neck will hurt.
Yeah, that's true.
Yeah.
Okay, great. Well, I'm glad you liked the treatment. Thanks very much.
Thank you. It's such a gift.